So this should work. Yeah. Okay. Great.
However, the robust data on the association of voice with disease state and clinical outcomes are lacking. So, voice signal characteristics have been associated with many pathological diseases like dyslexia or hyperactive disorder or Parkinson disease. So, the most important aspect when you are analyzing a data is analyzing any topic is the data. So, that's the study of population. So the data was obtained from multidisciplinary healthcare center, which is controlled by the Maccabi Healthcare Center, Israel, and the center provides telemedical services and where they treat various chronic patients, including the heart failures, the diabetes mellitus, the lung disease, and in this study, we will be analyzing anonymized data, uh, medical records with audio recordings of the patients that are enrolled in the medical center. So the population was mutually divided. The population was divided into two mutually exclusive groups, with one training group that only includes chronic patients, excluding congestive heart failure patients, and the another data set is the testing data set that only includes congestive heart failure patients. So the important aspect of this analysis is the vocal characteristics. Since this is a medical, when the medical data is involved, the obtaining is the most difficult task because of the involvement of confidentiality. So the data for this study were when the data was obtained, the to conceal the identity of the patients, the first 10 seconds of the audio recordings were deleted. So just to make sure that the patient's identity is not revealed, and the features were extracted in 100 temporal resolutions, that forming a matrix of 2000 columns. So 600 high level features were extracted from the matrices, and those features include jitter, pitch, shimmer, loudness, and all of those features are in the association with the frequency of the speech, the variation in the wavelength, and the loudness of the speech. And then the vocal biomarker was optimized for the training test using cross-validation techniques. And with the help of cross-validation techniques, many linear regression models, support vector machines, and logistic regression models were created. So this is just a 2 second snapshot of our features, where most of the data is been gathered in just 1 second. So on the x-axis we have the time, and on the y-axis we have features. And then we'll be moving ahead with the statistical analysis of the data. So the population was divided into 4 quartiles, where based on the vocal biomarker, and the quartile 1 is the lowest. So the 4 biomarker groups were compared using ANOVA test for continuous variable and the chi-square test for categorical variable. So the cumulative probability of death according to the vocal biomarker groups are graphically represented by Kaplan-Meier's survival analysis. So as you can see, on the x-axis we have the days, and on the y-axis we have the survival probability. So as the days passes on, the probability decreases from 1 to probably it goes up until 0.5, but that's for the quarter 4. But the lowest quarter that we have is the quarter 1, and then that goes up to 0.8 or 7, between 8 and 7. And the higher the number of here in the quartiles is, the more older the patients are. And the limitation is the limitation for this analysis is that it is a retrospective analysis that only involves a selected population of Hebrew and Russian speaking patients. And it is unclear whether this analysis would be generalized to the other population of the world. And lastly, the data on important predictor as well, that is the B-type neutralizing peptide level, that is a B-type protein present in our blood that makes our heart pumps the blood. The higher the level of this B-type protein is, that is, it's making our heart pump harder. That means that is one of the symptoms of heart failure. And the conclusion, I think this is the first study that documents the relationship between voice analysis and the adverse outcome among congestive heart failure patients, including mortality rate and hospitalization. And just imagine the possibility of and the potential it has to assist the healthcare providers for the betterment of rural and local communities. And that would be it. Any question? Any question? Or questions?
I guess I have one question.
Okay, sure.
I think you mentioned in a slide that you tried different kinds of models.
Oh, yeah, sure.
Which one performed the best at the end?
Well, the modems, well, this is a retrospective analysis. So it was in the Journal of American Heart Association. So what I've done is that I have just studied the research, and the
I see.
data was not available.
Yeah,
So it was
okay.
just a research paper.
Okay, I think I missed that part. Sorry. Any other questions? Just checking the online audience. Nope. Okay, great.